Good things often come out of hard times, and such was the case with PacificSource Health Plans. The Pacific Northwest was a vastly different place 85 years ago. The Great Depression made life challenging, and for those fortunate enough to have jobs, the work was often backbreaking. However, the logging industry was vital and employed thousands of people, all of whom needed medical care and the means to pay for it. During 1933, a group of Eugene, Oregon physicians established Pacific Hospital Association, the not-for-profit organization, to provide health insurance for local businesses and their employees. Doing business as PHA, we covered 600 lives at $1.25 per month in 1934, mostly logging and government contracts. At the time, hospital rates were $18 per week, and office calls cost $1.50. PHA paid 100% for, in the words of Max Wright, our manager from 1936 to 1965, practically everything. Slow, steady growth and solid resources made Pacific Hospital Association an attractive company in the 1940s. By 1945, PHA insured 4,500 working men and women at $2 per month. In 1947, we offered our first family coverage contract to Associated Plywood. As the country entered the post-war boom of the 1950s, PHA continued its steady growth, mostly in the timber industry. We celebrated our 20th anniversary in 1953 with 10,500 members. Premiums had risen to over $4, and hospital rates reached $13.25 a day. In 1964, the physicians at the Eugene Hospital and Clinic joined PHA as member doctors. In 1969, new contracts were developed for small groups and individuals to meet competition in the marketplace. By 1975, PHA premiums and contract benefits were now becoming more and more competitive. Name familiarity was growing due to advertising and word of mouth, and we began to expand our provider network in Lane County. In the 80s, the health insurance industry experienced increased utilization, and many carriers raised premiums dramatically in response to large claims losses. Thanks to selective marketing and conservative underwriting practices, PHA avoided large losses and continued growing steadily. As the company grew, we were in need of more space to accommodate our employees. In 1985, PHA purchased 60,000 square feet of property on Country Club Road for the construction of the new PHA office building. The 80s also brought changes to the industry as small insurance companies began to merge. This created an opportunity for us to expand beyond Lane County. With our market expanding, we decided to adopt a name that more accurately represented our company and the services we offer. Many names were considered, including Pacific Integrated Healthcare and PacificSource Health Systems. Ultimately, PacificSource Health Plans was chosen to let people know that we are their source for health insurance. As our market expanded, we also worked to build a larger provider network. By the late 1990s, we had become a statewide plan, providing businesses and individuals in all corners of Oregon with flexible health and now dental insurance. We moved into our new building in Springfield, Oregon in September 2003. That same year, we enhanced our position as a market leader and source for innovative benefit solutions by acquiring 2 third-party administrators, Manley Services, an administrator of flexible spending accounts, health reimbursement arrangements, and COBRA benefits, and Select Benefit Administrators, an administrator of self-funded employee benefit plans. In 2007, we achieved a key goal of our expansion strategy by entering the Idaho market and opening a regional office in downtown Boise, Idaho. We celebrated our 75th anniversary in 2008 ending the year with 150,000 covered members and newly acquired licensure in Washington. In 2009, we enhanced our Idaho market presence and dental membership through 2 acquisitions: Advantage Dental's commercial dental business and Primary Health Inc. of Idaho, which included Primary Health Plan, Riverside Benefit Administrators, and Idaho Physicians Network. Through this growth, PacificSource finished 2009 with 206,000 members. In keeping with our vision of becoming the leading community health plan in the region, we entered the Medicare and Medicaid markets in 2010 through the acquisition of ClearOne Health Plans Incorporated. With ClearOne's expertise in government programs, this union was the foundation for PacificSource Community Health Plans, our Medicare company, and PacificSource Community Solutions, our Medicaid company. It also helped us become a true community health plan and more effectively collaborate with healthcare providers to improve quality of care and provide people health coverage throughout their lives. PacificSource Community Solutions subsequently became the coordinated care organization in Central Oregon and the Columbia Gorge in 2012, an exciting step forward in our effort to create a more effective healthcare delivery system. The acquisition of ClearOne also allowed us to expand in the Montana market with 1,500 members. 2010 also brought great change to the healthcare marketplace with the passing of the Patient Protection and Affordable Care Act. In 2011, we opened an office in Helena and achieved licensure in Montana. In 2016, we partnered with Legacy Health Systems. This strategic partnership allows us to better engage and serve our members, and it strongly supports our ongoing efforts in population health management. Today, we are a full-service organization with licensure in 4 states, including offices in Bend, Billings, Boise, Eugene, Helena, Hood River, Idaho Falls, Medford, Portland, Springfield, and Tigard, offering healthcare solutions for individuals, small companies, large organizations, and government programs. We are well positioned to expand on our role as a community healthcare asset that can meet the needs of all community members. In 1933, our founders recognized the need to help all who needed medical care and the means to pay for it. 85 years later, our mission remains the same: